Meningitis. Bum, bum, bum. This is the lovely life cycle of that nasty bacteria called meningococcal meningitis. During this video, you will watch an ordinary respiratory illness turn into the deadly bacteria. This is the bacteria itself, Neisseria meningitidis. This little guy usually lives in the mucous membranes at the back of the throat. In 10 to 15% of adults, Neisseria meningitidis lives normally in the back of the throat without causing symptoms. When this little bacteria creates an upper respiratory tract infection, it can enter the bloodstream and travel to the brain. Here's how it works. The body begins to respond to the respiratory infection. Part of this response is that the blood vessels open to allow neutrophils out. Neutrophils are part of the immune response, which are designed to go crazy and eat all of the infecting bacteria. However, the Neisseria meningitidis can infect the neutrophils and hide from the other components of the immune response. From there, the bacteria can enter the bloodstream within the neutrophils. Unfortunately for the patient, Neisseria meningitidis is one of the few diseases that can cross the blood-brain barrier. This is how it works. Brain cells make connections through pathways. One cell will connect through a channel to another cell, and therefore bridge the blood-brain barrier. Neisseria meningitidis is capable of traveling through these connections between cells. Partially, this is because of their size. The individual bacterium must be small enough to slip through the connection between the cells. Once it has successfully passed through the blood-brain barrier, the bacteria can begin to infect the brain matter. Here is how it is transmitted. Neisseria meningitidis usually begins as an infection in the back of the throat. This means that it can be transmitted through any exchange of fluids. Common examples of this are coughing on someone, kissing, or children chewing toys. However, you should be happy to know that this deadly disease can be easily prevented through vaccination. The early signs and symptoms of meningitis are similar to flu symptoms. These include fever, headaches, joint pain, stiffness, and swelling in the neck. These symptoms are very similar to other infectious diseases and can be difficult to be distinguished. Once meningitis slips past the immune system, it can take longer than usual for the immune response to detect the infection and make a response. And as the body starts to fight off and attempt to kill the bacteria, blood vessels leak fluid to allow other fighting cells to enter the brain, causing swelling and worsening of the symptoms for the infected individual. The infection can spread through coughing and sneezing or the exchange of bodily fluids. If you are in close contact with someone infected with meningitis, contact a healthcare professional. When a patient who is infected with meningitis is treated, they are placed under quarantine to prevent further spread of the infection. There are several vaccines that are available to control the disease. A meningococcal A conjugate vaccine, C conjugate vaccines, tetravalent A, C, Y, and W135 conjugate vaccines, and meningococcal polysaccharide vaccines. Although it is never certain if a vaccine will help prevent the illness or do nothing to help the victims to fight the bacteria. Remember to get vaccinated.